Hello, my name is Sharon Milan, and I'm also one of the main organizers of this event. In 2009, my mother was diagnosed with malignant cancer of the sinus and underwent surgery and radiation early 2010. Since I was her primary caregiver during this time, I learned that not all of her follow-up treatments were covered by OHIP. The surgery which she had, in order to remove the tumor, left her with only half of the roof of her mouth. She then required, in order to speak and eat, a mouthpiece costing thousands of dollars, and multiple continuous treatments not covered by OHIP. This life-sustaining mouth device has been a huge drain on my parents' low, modest income, though without this, my mother would have to remain on a stomach feeding tube for the rest of her life. She would not be able to eat or drink anything without it coming out her nose. It would never and would never be able to express herself without slurring all of her words. Yet this mouthpiece that essentially provided my mother with a chance to once again receive a normal standard of living was not deemed medically necessary to our provincial government. Yet a woman can walk into an abortion facility and receive an abortion subsidized by that same government. OHIP basically needs to be made aware that they should be funding things that are life-giving instead of life-ending. It is very inspiring to see all of you here today. Thank you so much for coming out. This is my mom, and she's doing really well. And her cancer isn't coming back, hopefully, and we're praying so thank God. I'd just like to tell you about our next speaker. He's a man who understands what my family and I had to go through when facing a healthcare system that was unable to assist us with genuine medical necessity. Please welcome Michael Thompson.
Stand right there. A little bit over. This is my son, Blaze. Let's say hi.
Hi.
He lives with autism. He doesn't fully understand the significance of this rally, nor does he understand the significance of his presence here today, which I assure you is profound. However, he does live with the consequences of the sort of laws, or their absence, that necessitates this type of rally, just as he lives with the benefits of having the message of this rally accepted and implemented by society. In this and in many ways, my son Blaze shares the qualities of a preborn baby. In order for him to flourish, he needs the love and support and equal protection under the law of any Canadian citizen. Just so you understand, a child is typically diagnosed with autism around 2 years of age. At that point, that child needs between 30 to 40 hours of therapy per week in order for this to make a real difference in his life. This was found to be, and the costs associated with that are up to $80,000 a year. Currently in the province, there are about 1,900 children with autism who are not getting their basic developmental needs met by the healthcare system. Currently, you have to wait 2 to 5 years to receive treatment and even longer for the government to subsidize any costs. The waiting list is far too long for children to get the help when it's most effective. I know from experience that autism is an agonizing disorder for both the child and his or her parents, who naturally love their children and want to give them any needed assistance. Given the fact that autism becomes apparent around 2 years, as I say, any delays are unacceptable. We need to defund abortion now, devote the money to where it will really matter. You wouldn't expect a police officer to dash by a helpless person who has just been mugged in order to assist a perpetrator in a crime. Yet that is our government in action when it comes to how it employs healthcare monetary resources.
Well, I can tell you that today I feel exploited. I was a woman a young girl who was date raped. An abortion was proposed to me as a solution to end the life of my first child that was conceived through that date rape. The legalization of abortion in this country exploited women who were raped. I was promised that abortion would be a simple, safe procedure that would return my life to the way it was before the date rape. And I can tell you that I was lied to. My life never returned to the way it was before the date rape. Abortion took me down a very long road of pain, unnecessary pain,